Welcome to the Pacey Performance Podcast. Today, I'm speaking with Head of Rehabilitation at the Brisbane Lions, Selwyn Griffith. Thanks for tuning in to episode 109 of the Pacey Performance Podcast. So today we have a really interesting guest in Selwyn Griffith. So Selwyn, as we discussed in the episode a million times, has come through a different route to many S&C coaches and sports scientists out there because he's come through as an osteopath. So in this episode, we discuss at length how he's got to where he's got to and how his background as an osteopath has kind of moulded his practice and the way he goes about things, which I think is really interesting and definitely something to learn from the kind of for the guys that have taken the more traditional route. So just before we get into the chat with Selwyn, we have a Sports Science Minute from Coach Me Plus with Doug McKenney, who is going to discuss something that's on the minds of many practitioners out there, and that's training stress balance. Obviously, it's been on the minds for quite a while now, but it's great to get Doug's take on it from the guys at Coach Me Plus. So I hope you enjoy the chat with Doug, and I'm sure you'll enjoy the chat with Selwyn, which will follow immediately. So enjoy, and I will speak to you soon.
Hi, this is Doug McKenney with Coach Me Plus with your Sports Science Minute. A lot of cyclists and triathletes utilize training stress balance as a real effective tool for, monitoring their training on a daily basis. And ultimately what it does is it gives them the freedom to know that when it comes to their competition day, they're going to be at their highest level of performance, and at the same time, it'll reduce their chance for injury. And essentially that's what the goal should be for sports coaches. Many of them don't really know that the planning of practices beyond the X's and O's and the execution of drills and skills should include, fitness tracking. What it does, it assures that their athletes, their players will, go into that game situation at a higher level of performance because this tracking of acute training load and chronic training load over a period of time really help them to know that they'll be at that point. There are two key components to this, and that is the chronic training load, which is a measurement of intensity or load over a lengthy period of time, which would be somewhere between 28 and 42 days. And the second component or factor to it is the acute training load, which is a measurement of intensity or load of training day to day, and that's for a short period of time, somewhere between 3 and 7 days. So if you look at it from a graph perspective, what you'd be looking at is, let's say 1 month's work, and you can actually see the peaks and valleys of intensity of training. And when you're up in those peak levels of training, and you knew it, your practices were designed that way, you can see that peak level, and then you can see those bottom off levels, and where do they fit. And ultimately what training stress balance does is it helps you to answer some of these questions that are generally asked all the time. Are we working too hard? Are we training hard enough? And will we be fresh enough for that next game or competition? And so what you need to know is that you have to track this stuff on a day-to-day basis, and whether it's mechanical load, which would include speed and distance and stops and starts, accelerations and decelerations, or metabolic load, which would be specifically related to heart rate type stuff. Or you can use rated perceived exertion, which is another method to be able to look at how difficult or how straining or how intense the training is over a period of time. If you're collecting this stuff day to day, then what you actually have is your acute training load, and you're graphing it alongside your chronic load. By looking at this big picture of things, and mapping it out and looking at it from the standpoint of, we have a peak competition on Saturday afternoon, and I want to make sure that those 6 days before that, our training is right in line with being able to be at the highest level of performance and reduce the chance for injury. And I believe that, training stress balance is one of the best methods for doing this.
Thanks for tuning in to the Pacey Performance Podcast. So today I have the pleasure in speaking with Head of Rehab at the Brisbane Lions, Selwyn Griffith. So welcome to the podcast, Selwyn.
Thanks for having me, Rob. It's a pleasure to be chatting with you and get the opportunity to share a little bit of insight into what I do.
Absolutely, mate. So do you just want to give us a little bit of because you've got a bit of quite a unique background in how you came to your position. Do you just want to give us a little bit of detail around that and maybe your background in education?
Yeah, so I studied in Melbourne initially, so did a Bachelor of Applied Science and a Masters of Osteopathy at RMIT, and that basically took me into initially working in private practice as an osteopath, and initially in Melbourne, and then made my way to the Gold Coast in North Queensland, and basically from there worked in a private osteopathic facility, and then also an exercise rehab, basically gym facility as well, where I'd work predominantly one-on-one and sometimes in small groups with amateur, semi-professional athletes. And about 5 years ago, got the opportunity to work part-time with the Brisbane Lions as an osteopath and just consult a couple of days a week, which was an opportunity that I definitely couldn't turn down because I played AFL as a junior and have always had a love for the sport. So, basically started just working with the medical team and anytime I could get extra time with seeing how they ran the program and what was happening, I'd just spend extra time there, and was fortunate enough at the end of that year for them to offer me a full-time position, and have been full-time ever since, basically transitioning from pure medical now into more the performance and medical side. So initially was helping out with the injury prevention and what we term athletic development component, and then into developing strength programs for our 1 to 4 year athletes, and now as head of rehabilitation for the Lions, which has been a great transition over the last 4 or 5 years.
Do you just want to give us a little bit of just an insight into osteopathy itself, and maybe kind of where your head's at when it comes to when it first came to you getting involved with the Lions, with regards to the work that you were doing compared to maybe how you thought compared to the way other guys thought?
Yeah, so I guess the big thing with osteopathy is it's different in every place in the world, really. So in America, they're seen as orthopedics and actual GPs, whereas here in Australia, we're seen as primary healthcare practitioners in the form of manual therapy. So, you wouldn't see an osteopath necessarily working in the hospital sector. They're predominantly in private practice and in small clinics or large sports medical clinics. So from my end, it's predominantly a manual therapy component. And I think that's the slight difference that we offer, I guess, from say how some of the physios are initially trained here in Australia. The benefit from osteopathy is from day one, you're just taught to treat and to feel the body, to watch the body move, and we don't have to delve into hospital care or senior care or anything like that. So it's a real benefit from day one. You just start to feel how the body moves, see how the body moves, and you're starting to treat basically from day one. So for a 5-year degree where you're developing your manual therapy skills, I think that was one thing that definitely accelerated my progress. And basically the Lions were looking for someone to help with management of some of their spinal and kind of pelvic issues, as AFL is quite a high impact and high load sport, but it's also predominantly an asymmetrical sport. So they were finding that they were having a few low back issues and some pelvic issues, obviously groin and hips being such a large component of what the athletes do day to day. So they thought that it just might be of best interest to see if having someone with, I guess, a different background and a different experience could offer different opinions. And I just, day one, kind of, it was more so come in and make sure that I was just facilitating whatever the rest of the medical team wanted and thought was best for the athlete. So there wasn't really a case of, all right, Selwyn, you're the osteopath, you're going to do this, and he's the physio, he's going to do that. It really, from day one, was a collaborative approach, and the only thing that really differed was my skill set from a manual therapy perspective was slightly different to the physio's skill set, but how we were applying it, to the tissues or the joints didn't differ too much.
Mm-hmm. So why isn't there more people come from the osteopath background, or did they? It's just called something else, other in Australia or around the world?
Well, I think osteopathy probably just hasn't been able to break into the high performance sports market as well as what it would like as I guess an occupation. Now, whether that is because we don't have a specialised kind of sports program offered like in physio here in Australia, you can do a Masters of Sports Physio or a specialisation in sports physio, which is probably something that that accelerates that next level of physiotherapist to the top level. And it's probably the thing that I've been very fortunate is I've been exposed to some of the best sports physios in Australia, I believe. And so their skill set that they get from that program is definitely a little bit more than what osteopaths are offered in their 5-year degree. But also, unfortunately in the high performance sports areas, kind of you don't want to change things too much. So bringing in an osteopath or a chiropractor or these things can sometimes cause a little bit of disharmony. So I think it's also a case of finding the right personalities to fit within a collaborative environment. I definitely think there's opportunity there for osteos and chiros to complement a collaborative high performance environment. It's just all about finding the right personalities. You see it in the UK, there's definitely osteopaths have done well at working within high performance sports environments over there, and there's definitely been a lot of exposure with them with Olympic athletes and working around the Olympic sports. But yeah, definitely here in Australia in professional sports, in AFL and rugby league, rugby union, there still isn't a huge exposure of osteopathy at that level. But there definitely are a few other guys in the AFL that have started to work with a few teams. So it's great to see, and I think long term it'll definitely be beneficial because you just get people sharing different experiences and different ideas, and at the end of the day we're all after the same thing. We want to provide the best environment for the athlete to prosper themselves from a performance perspective, but also from trying to prevent injury and increase return to play timeframes and those things.
So in the early days when you were kind of solely an osteopath, how were you? What were your roles, and how did you kind of plug into the day-to-day workings around the S&C coaches, the sports scientists, and the physios?
So I predominantly dealt with the head of medical and the other full-time physiotherapists. So basically I'd come in 1 or 2 days a week depending on the training and playing schedule, and basically they'd give me a quick snapshot of, all right, this is what's going on with our playing group at the moment. These guys have this issue and this guy got this corky on the weekend, or he's had some niggling groin issues over the last few weeks, and then they might provide some data on some of their screening stuff, which then I would just use to facilitate my examination and then my treatment of the athlete. And then if I thought that something needed to change, whether it was from a gym perspective or maybe their field training, I'd just basically give that information back to the head of medical and the head strength coach, and then they would facilitate that. So they were pretty open with any ideas that I had. They just said, see what you find and what you think, and we want to know. We're not saying we're going to change every guy's program just because you've said something, but because it's a new set of eyes and a new way of, I guess, evaluating, they were really open to it. So it worked really well initially. And then when I wasn't treating, I'd just try and basically be a fly on the wall. So I'd just head down to the gym and watch guys lift and help them if they needed it, or help the S&C staff if they needed anything. And that really helped develop my relationship with the other staff members in the high performance department, but it also kind of got the players to understand why I was there a little bit more and develop my relationship with them. So then when I was explaining, all right, this is what I think you need to change, or this is what we're going to do to try and improve your movement, they definitely bought into it a lot more.
Just before we move on, talk me through a corky.
A corky is basically just a muscle contusion. So when someone's had an impact and you get the swelling around the muscle. So typically we see quad corkies or calf corkies in AFL. So usually it's someone else's knee impacting into one of our guys' thighs or calves and creating a muscle contusion. But yeah, we just call them corkies.
No, that's good, mate. I just thought I'd clear up for the non-Aussies out there.
No, that's fine. We have a little bit of different lingo.
I played to it as if I knew what it was, but I didn't. I'm just...
No, all good.
So when we were chatting beforehand, we had a little chat about manual therapy versus exercise therapy. Do you just want to give your kind of take on that scenario?
Yeah, so I think, there's a lot of conversation happening at the moment with, does too much hands-on create a dependency for the athlete, and then that they never truly understand how they can help their body and help their movement versus, all right, let's just get this guy moving and we're not going to treat him. And there's definitely a happy medium. I think Dan Paff talks really well about it, that performance triad of having the coach, the athlete and the therapist, and how they integrate together. So I definitely, in my first year with the Lions, because my role was primarily just an osteopath, I would predominantly just treat, and I wouldn't do too much in regards to exercise prescription and taking them into the gym. Whereas now with my rehab guys and even the healthy squad guys, I might treat for a little bit and we'll assess their movement pattern, and then I'll get them off the table and we'll go into the gym and we'll basically groove that movement pattern. So I'll find what movement do they feel most comfortable with, what if they're coming back from an injury. So let's say they're coming back from an ankle injury, an ankle sprain, and they're still their ankle range of motion is still down, but I can treat it a certain way and it improves it. And then how do I get them into the gym and maintain that range, whether it's through a squat pattern, a lunge pattern, anything, a step up pattern. And so, yeah, I probably am less manual therapy and a little bit more movement prescription, but I definitely think there's a happy medium between the two. And the benefit of using both is you educate the athlete at the same time. And I think that's the most important thing, is if you can change it with just a little bit of manual therapy, and then you take them into the gym and you educate them about the movement pattern that helps facilitate that or maintain that movement, then all of a sudden they start to fill in the blanks, and they understand what they need to do in order to prepare their body for training, or prepare their body for a gym session, or even recover from a session, in order to make sure that that restriction or that inhibition of that muscle doesn't continue.
So has your mentality towards that changed as you've been exposed more to the kind of S&C coaches and the kind of gym-based guys down there?
Yeah, definitely. I've been very fortunate to probably get exposed to a few guys like Dan, who travelled to Australia, and spent a little bit of time with him down at GWS, and even through Exos and Athletes Performance, and some stuff that I've done with them where their philosophies on using movement to facilitate an athlete's recovery and facilitate, improving joint range of motion and tissue quality, I think has definitely improved me as a practitioner and as an S&C coach.
Cool. So I just want to talk through a bit of your role as the head of rehab, and just talk about the kind of return to performance stuff that you've got going on down there. Do you just want to talk to us a little bit about maybe what it was like when you first came into the role, and maybe what you initially wanted to put in place with regards to the kind of RTP protocols, and maybe what it looks like now?
Yeah. So my transition into head of rehab was based on we had a bit of a change up in our high performance department, and that was a role that they thought that I could transition well into, given my medical background, but also experience in S&C. And the biggest thing for us was we wanted to create the rehab environment as a team within the team. So create a culture and an environment that challenged the athlete, but also facilitated them to enjoy what they were doing. Because, unfortunately, with rehab, if you do an ACL, you can be in there for 10 to 12 months. And unfortunately, if you re-injure it, then you're in there for another 10 to 12 months. So all of a sudden, an athlete who in AFL, your lifespan is basically 5 years, is the average lifespan, less than 50 games. So you only have a small window. So we wanted to make sure that if a guy comes into rehab, that they're exposed to the best environment possible, an environment where they not only rehabilitate their injury, but they come out a better athlete holistically. So for me, first and foremost, it wasn't so much about changing or adjusting our return to performance plans and our markers, because they had already been really good, and something that we'd sat down and diligently kind of gone over a really structured process. It was more so about developing an environment where they felt comfortable to approach me and basically say, all right, Selwyn, this is what I feel I need to improve while I'm in rehab, whether it's they're in there for 2 weeks, 4 weeks, 10 weeks. I feel like I need to work on this while I'm rehabbing my other injury. And for me, it was about creating a bit of a journey for the athlete. So making sure that along that journey that you create goals and challenges, and whether that's an individual one or even a team-based one, because we tried to create that rehab team mentality. So we had, catch-ups with the rehab group, or times where the rehab group would review what the main group were doing and present that back to them. So you always want to make sure that group feels as part of the whole team as possible. And if we can develop those challenges and goals along the way, then once they integrate back into the team, they feel like they were never left, and hopefully they come out being a better athlete, as I said, holistically, not just from the injury that they suffered.
Just going to take a very quick break in the chat with Selwyn. I hope you're enjoying part 1, more training talk from Selwyn in part 2. But just want to say a massive thanks to Coach Me Plus and Vald Performance, makers of the Nordboard, for sponsoring this episode today. As I say every week, the podcast couldn't continue without them guys' support. So really appreciate both Coach Me Plus and Vald Performance for sponsoring the episode today. So hope you enjoy part 2. Would love you to let me know what you think of this episode and the podcast in general. All feedback is greatly appreciated. So I hope you enjoy part 2, and I will speak to you soon. So how much exposure are you giving the rehab group to the main group? And the reason I say that is because from my experience, we had managers that wouldn't let the main group go in the physio room unless they were injured, and then vice versa. As soon as the lads were out on the pitch, injured lads couldn't get involved in that main group for whatever reason. Then we had other managers who it was very integrated, and they wanted the rehab group to get involved with the main group and still feel part of the team. How does that work down there?
Yeah, our philosophy is definitely integrate any time where possible. Now, obviously, you've got to make sure you're minimising risk of putting the athlete in a compromised position, but yeah, integrate where possible. So if I've got an athlete who's kind of in what we would call like our phase 3 return to function or sports specific, and they've done some linear running, they've maybe intro change of direction, and the main group has a light handball drill to open up with, I'll put that athlete into that drill. It might only be a 5 or 6 minute drill, but you know, some guys really that motivates them even more to work harder in the rehab environment. So if you can give them those little exposures to what the main group's doing, I think it not only motivates them, but it also keeps them involved, and it keeps them educated in what the main group's doing, because the main group is always evolving in regards to the drills they're doing and the type of movements that we're doing on the ground, flow patterns and things like that. So if you take them out for too long and don't expose them to any of that, then all of a sudden their first main training session with the group, they're doing the wrong running patterns, they're missing kicks, they're missing handballs, and you might have rehabbed their injury, but they've actually come back a worse footballer. Which is the last thing that I want. So yeah, we're definitely integrate where possible. At the rehab guys are typically always the first guys into the club and the last guys out. So they're there, yeah, for long periods of time and work very hard. And so if we have a field session that maybe the main group starts at 10 a.m., the rehab group would be out there at 8:30 a.m. or 9 a.m. and we'd be doing our linear speed, our run-throughs, whether it's change direction. So I try and get that sort of stuff all out of the way before the main group start, because then if a player is going to integrate into the main group, they've already done a full warm-up. They've ticked off some of their GPS variables that we need to do, whether that's high-speed running or sprint meters. They've done their hard change of direction under supervision, and in whether it's in a controlled or uncontrolled environment. And then it builds my confidence to go, all right, you're ready for that drill. And then the athlete also knows, yeah, I feel good, you know, I'm ready to go. And then basically our guys, if they're not going into main training, would then roll straight into gym. So majority of our guys, would complete a field session. They might have to have a quick bite to eat, and then they'd be in the gym for one of their strength sessions.
So you touched on there just the a couple of the phases that you go through as a kind of return to performance. Do you just want to talk to us a little bit about them phases and the markers that you hit as the guy goes through the system?
Yeah, so as I mentioned, we went through a kind of a big review of our rehab program a few years ago and tried to identify key areas that we wanted to focus on throughout each phase. So the phases adjust slightly dependent on the injury, of course, but we tried to identify basically a 5-phase program. So where phase 0 was basically immobilized rehab or recovery. So that's more focused at guys who have a surgical intervention. So if they're in a moon boot, they're in crutches and those things, that initial stage is based on recovery. It might be identifying kind of areas of individual focus if they've had other injuries in the past, and then we'll load them as soon as possible, basically through their kinetic chain. So if they're in a moon boot, let's say a guy who's had an ankle reconstruction and he's in a moon boot, once we've been given the all clear from the surgeon from a recovery perspective, then he'll start doing some seated upper body loaded work, or even some just machine loaded stuff to make sure that we're continuing to develop lower body strength, core strength, upper body strength all at the same time. And basically that phase, coming out of that phase is just based on a criteria goal. So the immobilized rehab majority of the time will be based on, all right, are you out of the boot or are you off crutches, and those sorts of things. For guys who have soft tissue injuries, typically that immobilized rehab isn't something that we need to touch on. So they'd go straight into phase 1, which is our acute rehabilitation. So that's where we focus on our range of movement, and basically movement competency of the tissue or the joint that's been injured, and a strong focus on our kinetic chain strength. So once again, if it's a guy who's had an ankle reconstruction, it might be their dorsiflexion, plantar flexion, or first MTP range of motion, and setting criteria goals along that path. So we collect dorsiflexion range of motion as a weekly marker or throughout the season. So we have longitudinal data on all of our athletes from that test, and basically if they have surgery, we know what their pre-injury status was, plus what their other limb was as well. So we've got that comparison, which then we can set goals along that way. And then in that phase as well, you'd have gait retraining, some proprio, and then they would start some form of some calf loading. So with that end of phase 1 on, in particular for an ankle rehab, we're looking at them regaining their normal gait and pain-free range of motion, and we'd like for them to be able to do double leg calf raises for greater than 30 repetitions, just as a pure tissue conditioning perspective, so that we just know that once we get into phase 2, they should be able to start loading in a single leg component. So our phase 2 looks at progressive loading. So that's when we really start to look at that tissue specific loading. So for an ankle or foot, that would be calf, soleus, peroneals, tibant. And what I like to do is break it down into exposing that tissue to different loads. So that might be different lengths, speed, but also a thing that I really like to work on is loading the tissue in the position of injury. So if the injury occurred in a forced plantar flexion and inversion perspective, then in this phase, I want to really work on loading that joint in that position, because when you've had an injury like that, you get disruption of so much tissue, mechanoreceptors, everything. The joint just doesn't realize where it is in space. So once we start to load that tissue, not only is it about returning function to the joint and to the muscle, but it's also about re-educating where that body part is in the brain, because you get that disruption from major trauma. So that's a big focus for us in that phase 2, and making sure that basically each loading in that phase is athlete specific because, as we know, every athlete has anatomical differences. So loading one guy with a certain exercise, he might feel it in his gastroc, whereas another guy might feel it in his soleus. And with guys with different ankle ranges of motion, you might have to work inner range versus outer range. And so we kind of, in that phase 2, it's really honing in on what's specific for that athlete to help speed that rehab process on as much as possible.
How much work are you doing on the non-injured leg? If it's a leg or non-injured arm or whatever it may be?
Yeah, so typically we'll do more of a strength focus on that to try and work on a bit of that neuro carryover. So we'll look at maybe doing 2 to 3 sets of 5 to 8 reps, depending on the area and on the tissue. But yeah, we'll continue to work on that throughout the entire rehab process, because if we can get some carryover to the other limb, then it'll definitely help to speed the rehab process up. But also, the last thing you want is to develop to develop one leg that was injured and then forget about the other side. So, it's definitely a continued focus for us. We might only hit that twice a week, right? Whereas with a lot of our rehab guys, they'll be doing anywhere between 3 to 5 gym sessions a week. And that'll be a combination of strength and movement competency throughout that, especially with some of our kinetic chain loading. It's kind of been a really big focus for us. If they've had a previous injury on another area, how can we strengthen that area so that when they come back from that ankle and foot, but maybe they used to have a groin injury, how do we make sure that throughout the rehab process of that ankle, does the groin not aggravate once they get back to running?
Mm-hmm. So you mentioned... Go on, mate. Sorry. Go on.
No, you go.
I was going to say, you mentioned gait retraining. Do you want to talk to us a little bit about what that might look like? Yeah,
so early stages, I do a fair amount in the swimming pool, just to decrease a little bit of the joint load. Plus also I find that a lot of the players feel more comfortable in the water. So we might be as simple as just working through that cyclic motion of making sure they're lifting their heel up towards their bum, getting good knee lift, because a lot of guys will develop that antalgic gait and kind of externally rotate the leg or the foot. So we're just working on very simple mechanics. I don't try and tell them too much. I just kind of say, all right, I want you just to think about walking forward, and then I might get them walking backwards as well, walking kind of karaoke side to side. So it's all about reintroducing the movement to those joints. And like I was saying before, it's as much a joint injury as it is a brain injury. So it's re-educating your brain talking to that joint again. So if I try and give them too many cues of, all right, I want you to think heel to bum, knee to sky, bring your toe to the roof, I think they get more frustrated at me than they do about the actual exercise. So we'll do even some wall drills on it. So, like a wall posture A or a linear acceleration just on the side, lunge variations. And like I said, going forwards, backwards, side to side. And then I'll take that on to doing some mini tramp stuff. And we have a gymnastics tramp at the club as well. It's about 15 metres long. So even just doing walking A's, marching A's on the tramp, just gives them that different proprioceptive feedback. They've got to stabilise a little bit better, and it just reduces a little bit of that force before we then take them onto the ground. Or we have even done some hopping and jumping in the Alter G. So we use the Alter G definitely to integrate our plyometrics before running on ground, and that's been, I think, something handy because it's easy to adjust. Sometimes the swimming pool, depending on if your belly button's under or chest's under, obviously it's always going to be different. But on the Alta G, you basically put it on 70% body weight, and it's always going to be 70% body weight, and they're locked in at their hips. So that's another one that we use for the gait retraining and just as a kind of almost return to running progression.
Mm-hmm. So as head of rehab, what's the next thing for you to kind of develop that's maybe not lacking? That sounds harsh, but something that maybe needs developing that hasn't happened over the last 5 years since you've been there?
I think, you can never stop learning. Yeah. So for me, it's always trying to improve my ability at conversations with the athlete and making sure that, what you're giving the athlete is the right amount for them. So, in this day and age, unfortunately, probably return to play decisions are the hardest thing to be able to go, yep, he's ready, or no, he's not ready. So it's developing that skill set that allows the athlete to feel comfortable and confident enough in approaching me and saying, yeah, listen, I think we're doing too much, or I think I can be pushed a little bit harder. And every athlete is slightly different. So, knowing when and where to kind of push and pull is definitely a skill that can only come from just continuing to converse with the athlete. The data analysis side of things is getting bigger and bigger. So I'm pretty fortunate that I've got some pretty smart guys around me that help to facilitate that. And one guy in particular, Nick Murray, who works with our GPS system and has done some work under Tim Gabbett. He's been really good with helping to develop those return to play guidelines and markers from a GPS perspective. As that's something that's been huge at the moment. And so continuing to work on those elements, I think, will not only help myself develop, but help the rehab program develop. So, hopefully the next couple of years we'll continue to prosper.
Nice. So who are your, just before I let you go, who are your kind of go-to people that you look to for info and to pick the brains of?
There's some. We're pretty fortunate here in the AFL that you've got some pretty smart guys who I can, and everyone's really forthcoming in regards to just having a conversation. Obviously, we don't share too much of the ins and outs of day to day, but I've been pretty fortunate to work with Brett Burton. He's now at Adelaide Crows, and Matt Haas. Damien Austin, our current high performance manager, has been really good as well. He came from the Sydney Swans. Pretty fortunate to know David Joyce and Lockie Wilmot at GWS, and Phil Merriman from Hawthorn, and Dan De Pasqua at the Melbourne Storm. These guys they're all working in really good environments and really collaborative environments as well. So just in Australia, they're guys that I definitely chat to a lot. But outside of that, Bill Knowles has always been someone that I've kind of looked at with some really good return to performance guidelines and plans, and Matt Jordan as well from the Canadian Sports Institute, and Jeremy Shepherd, who used to work here in Australia. I've been really fortunate to learn from those guys. But these days there's just so many opportunities to learn from great people. I'm pretty fortunate that where we are here in Australia, we've got some of the best minds going around, I think.
Mm-hmm. No, absolutely, I'd agree. So where can people get in touch with you? You're obviously a Twitter man as well, where I stalked you.
Yeah. I'm on Twitter. I don't. I use it a little bit. I had a few videos that I put up this year of just some of the return to play exercises that we use with different injuries. So I'm just at Selwyn Osteo on Twitter, and then if anyone wants to get me on email, it's just sgriffith@lions.com.au. I'm more than happy to chat to anyone about anything. As I said, I'm always keen to learn and keen to meet new people. So would love to hear from anyone.
Great. Well, I'm going to let you go. I'm just conscious of time. So I really appreciate you giving all your insight into what you do down at the Lions. So we'll keep in touch, mate. And thanks again for your time.
Yeah, no worries, Rob. Thanks for letting me on.
No worries, mate. Speak soon.
Cheers.
Thanks for tuning in to episode 109 of the Pacey Performance Podcast. Hope you enjoyed the chat with Selwyn. So I thought it was great to get someone on who, although may seem to be in a kind of traditional role, has come to it via a different route and get their take on how they think a little bit differently because of their background. So it was great to have Selwyn on. So massive thanks again to Coach Me Plus and Valid Performance for sponsoring the episode today. Hopefully some great guests coming up over the next couple of weeks. So make sure you keep tuning into the podcast and listening, and hope you enjoy what's coming up. So thanks a lot again for your support as always, and I will speak